Are we good?
Yes.
Yeah, everyone can see it.
Good.
Okay, thank you so much. It's such an honor and a pleasure to be here with you guys this evening. So the title of my talk is Reversing Brain Damage and Cognitive Dysfunction in NFL Football Players. I think this particular topic is so timely and relevant for this particular organization. And I'm going to share some of the work my colleagues and I have been doing with football players starting back in 2009. A lot of discoveries have been made in the last decade in terms of what we know about chronic traumatic encephalopathy, the neurodegenerative disease that we're starting to see in not only professional football players, but military personnel and other individuals who are participating in contact and collision-based sports. So what I'm going to do is give you an overview of some of the research that my colleagues and I have done and the strategies that we used to help what I would call restore brain function following mild traumatic brain injury.
Dr. Willeumier, if you could press a slideshow on the top, it's not full screen.
It's not full screen. Oh, yes. Let's do slideshow. There we go.
Beautiful,
Oops.
perfect.
Okay, we're all set.
Fantastic.
So Martin gave you my background, so we can skip this slide and go straight to 2009. I became director of research at the Amen Clinic. So for those of you who are not familiar with Amen Clinics, they are a very large outpatient psychiatric clinic that focuses on treating people with complex psychiatric disorders. So the kind of people that would come into our clinic typically failed 3 previous treatment providers. They had on average 3 to 4 diagnoses, or on an average of 5 to 6 medications. So in a clinical setting, we would use sophisticated neuroimaging technologies to really help target and treat psychiatric disorders. The Amen Clinics currently has 9 clinics throughout the United States. They see on average 3,000 to 4,000 patients monthly. And when I was there, I helped them establish a very large neuroimaging database. So at the time of my departure, we had 130 scans. I assume now they're probably 160,000. So I've been able to see the opportunity to see thousands of brain scans, both functional and electrical. And that's really going to help give you more of an indication of what kind of things we're seeing in the clinic in these professional athletes. I also held the role as the director of nutrition and nutraceuticals. So in our psychiatric clinic, we take a very holistic approach when treating patients. So if we could use supplements and natural therapies prior to using medications, that was what we would do. So I was also in charge of running the clinical research trials on nutraceuticals, some of which I'm going to share with you in the presentation this evening. So for those of you who aren't familiar with the brain SPECT imaging, SPECT stands for single photon emission computed tomography. It's a nuclear imaging study that measures blood flow and activity patterns in the brain. And you'll see in the scan here on the left, you're looking at the surface view from underneath. What we're looking for is full, even symmetrical activities. That's the surface view of a healthy individual. Then we're looking at the internal view. This again is a healthy individual. We want to see blue, mostly in the brain. So blue is average activity, and the red and white are higher levels of activity. And we want to see that in the cerebellum, in the back part of the brain. So I'm going to tell you about our clinical trial that we ran back in 2009 in our professional athletes. And the reason why this is important is not only did we start this in 2009, but I've been following these athletes longitudinally over time. That's really going to help to give you an idea of what they're going through. So when we were first running this trial, we measured 100 active and retired NFL players. They had to have been on an NFL roster for a minimum of 3 years. So that would mean they probably played a minimum of 12 to 13 years of football. And we compared that group to 100 healthy subjects. We players across 27 teams from all positions, ranging in age as young as 25 and still on an active roster to as old as 82. And our study design in the clinic, we were very comprehensive. So everybody got a diagnostic history. They got functional brain SPECT imaging at baseline and while performing the Conners Continuous Performance Test, which is a test of focus and attention and executive function. It helps as a measure of ADD. And everybody got quantitative EEGs as well. We had everybody do a mild cognitive impairment screen, which is a verbal test of dementia, which I administered, and then a microcog assessment of cognitive function, which is a computerized assessment of cognitive function. So our study results showed that 48% of our cohort was obese, 30% of our cohort had undiagnosed sleep apnea, which we know if left untreated can double your risk for Alzheimer's. 28% of our cohort had depression, which is 3 times that the national average. 81% scored abnormally on the Conners Continuous Performance Test. 19% of our group had a diagnosis of dementia. And on the microcog assessment of cognitive function, they scored below average in 7 out of 9 categories. The 2 categories they excelled in were spatial processing and reaction time, which is not surprising given that this is a group of highly professional elite athletes who are good at tracking a ball in space. So our study results showed, not surprisingly, significant global hypoperfusion present throughout the brain. You will see in the image to the right, the arrows show low perfusion in the brain. If we don't do anything to correct those areas of low perfusion,